Women should have a choice, which is often caused as a missed disease. It is a missed disease. It is endometriosis.
I want to get some numbers. How common is this?
You'll be surprised to know this 1 in 10 women suffer with this. See, women are very tolerant people, At the same time, the monthly cycle, which is natural for a woman, it restricts them. That is the sad part of it. The woman prepares a bed so that an egg can come and get implanted. Has a pain. There is a pattern for this pain. So when I ask a question, when do you have pain?
What are the causes for this? Does it have any effect on fertility?
So sometimes you'll be surprised, the endometriosis may not be painful as well. You may not see endometriosis on scan. Actually, that is the gold standard of diagnosing endometriosis.
Let's talk about the condition of the women in India,
Okay.
or rest of the world for that matter. How would they go about getting it diagnosed?
In England, it takes 9 years. In America, it takes 11 years. In Germany, it takes 10 years. In Wales, it takes 10 years. Like that, we have statistics. Not every woman needs a laparoscopy as well. It has an economical impact as well. I'm very happy for you doing this podcast, to be honest, because I want even men to listen to this.
This conversation is very important because we are going to talk about women's health. Why a woman during menstrual cycle has to be in pain. I've got one of the top gynecologists, Dr. Marthi. Welcome to SoulSync. How are you?
Oh, great. Thank you very much for inviting to the podcast. Thank you.
Before we get into women's health problems, can you please take a few minutes to give us some introduction and background about you?
Yeah, okay, thank you for that. My mother, although she was always, I have to say I became doctor for her. She always wanted me to become a doctor because we had 3 daughters. Those days, oh, you have daughters and all that. Then she said, this is the only specialty you can save 2 people. And she said, it's the only specialty you see happiness. She was absolutely right. Absolutely right. It's a wonderful specialty, I feel, because, birth of a baby is the most joyful thing for thing. So that's how I became a gynecologist. I'm actually a student from Andhra Medical College. I started my post-graduation in Usmania Medical College. I have to say it's a treasure. It's a treasure of knowledge. And there's what they call in those days, like it's a government maternity hospital in Hyderabad, with a delivery rate of 14,000 to 15,000 per year, such a big number. And I joined in the specialty in 1989. So from 1989, 3 years, as you know, the post-graduation. And after 92, I worked in villages. That's another wonderful experience, I have to say, where I was seeing women in villages with antenatal problems and all. I was really blessed with wonderful in-laws. He was the person, what he did was, he saw an advertisement in Indian newspaper, people can apply for MRCOG. And then he made me to go for the MRCOG exam, which was in Nepal those days, okay? So I did MRCOG. As soon as I finished my part 1 MRCOG, the British government actually wrote a letter inviting me to come and work in England. I had to do my exam, PLAB exam, and then I joined, I became as a junior doctor. Up to 96, I joined obstetric and gynec, and I worked in different hospitals in England. When I became a GP, I was seeing more women at this with a lot of common problems. I don't know, I feel I could help more women as a GP with a special interest in gynecology. Now, I'm a community gynecologist for 40 practices. So I see women from 40 practices. So you can imagine the workload, So basically, we reduce the referral rate to the hospital. Yeah.
30 years of
experience.
You must have treated thousands of patients during the course of last 30 years. And also best outgoing student during the time you studied in the Andhra University, which is amazing. And every word that you're going to tell today will have a lot of weight, and it will also relate to so many people, especially women, of course. So I'm really looking forward for the conversation, and let's go and check what common problems that women face. If you can start with that, and then we can dwell deep into individual one.
See, women are very tolerant people, So they have to balance. They want to be very competitive and go up academically. At the same time, they will want to have a family. They want to be the best wife, best husband, and best father, daughter or daughter-in-law, like that. In spite of all this, this is what they want to juggle, okay? But at the same time, the monthly cycle, which is natural for a woman, to have the menstrual loss and all, it restricts them. That is the sad part of it. As long as the menstrual loss is is a mild discomfort, it's okay. When it start becoming painful, sometimes she cannot hide from the family, but she wants to hide, and she literally suffers. Okay, there are millions of women in this. They just suffer with painful periods. So I have to say the common condition I see is pelvic pain or painful periods, and the next one is heavy menstrual bleeding. So they have heavy periods, and then they become very weak, and sometimes their cultural taboos will be there. They cannot pray during that time. In any culture, they have the taboos, whatever the religion background is. And those two are the important things which we are commonly saying. The third problem, another problem I see is fertility. Like people want to conceive, they cannot able to conceive. And one more thing is, I'm very happy for you doing this podcast, to be honest, because I want even men to listen to this, to be honest. Because there is the thing like women cannot have a normal sexual life if she is in pain, okay? That actually causes relationship problems. Unless the partner is very understanding, the woman cannot, it's very difficult. It causes just not a physical stress, it even causes mental stress on her, because it's a relationship problem will be there when she cannot have a normal sexual life. And that can lead to infertility problems, and those are the things. And also the other thing is that contraception is very, very important. There are taboos for contraception, but the contraception, women should have a choice. When she wants to plan pregnancy, she should be able to plan. So contraception is another important thing.
Sure. So you mentioned 3 common problems. Yeah. One is pain, and the other one is fertility issues, and the third one is contraception. Yeah. Right. Let's pick the first one, which is the pain.
Yeah.
And for me, it's not right, because if they should get support that they need, not just from themselves to go to the doctors and get it checked, but also from everyone around them, because you touched upon it. Young women need support from their parents. Young girl needs support from their fellow friends or anyone. As a wife, 100% she should get support from her husband and also from in-laws. We'll touch upon the emotional side of things for sure as we go along, but let's dive deep into that pain that they get and what they can do, what are the symptoms, what age it starts. So all of that we'll cover. Let's go to the symptoms first. Please, let's talk about symptoms.
There's so many things which can cause pelvic pain. Any infection of the ovaries, tubes, that can cause pelvic inflammatory disease, that can cause pain. If the woman has any cysts or, like a thing, that can cause pain as well. If there are some conditions like fibroids, because some things, like lumps on the womb, that can cause pain as well. But the most important condition, which is often caused as a missed disease, it is a missed disease, it is endometriosis. What is endometriosis? That is the one thing I just want to say. Normally, do you mind if I just show you a picture? I brought something for
Yes,
that.
please. Okay? Yeah, that is the camera that you need to show. That is the camera.
So this is a uterus. This uterus is two abnormal uterus. It has all the diseases, okay? But this is how the women womb will be. Normally what happens is the lining of the womb becomes very thick. Every month, women has a period every 4 weeks because of the hormonal changes. And at the end of the 4 weeks, if she's not using any contraception, or if she's not has not become pregnant, she will automatically has a menstrual loss. It is a physiological condition. Okay, it is a physiological thing that a women hormones cause the lining of the womb, and the menstrual loss happens for 4-5 days. And just if you imagine yourself, like, when somebody has pain passing urine, oh my God, they'll go and see a doctor. When they have pain opening bowels, they'll go and see a doctor. But when they have pain, it is taken as granted, oh, it is something natural, it happens every month, why is she moaning about it? No. that is not. It can cause some discomfort. It should not be painful. The common cause which can cause pain is endometriosis. That means this lining of the womb can present outside the womb. What happens is some of the we don't know the exact reason of that. Okay, there are so many theories. We'll be the whole day here talking about the theories. But that blood can spill into the pelvic or into the peritoneum or pelvis, and it can spots. I don't know whether you can see the spots. See, the spots can be behind like this. And these spots are nothing but the lining of the womb, which is outside the womb. That is it. That is why it is called endometriosis. What happens? Why the spots there? But what happens is every month when the woman has the period, these spots will bleed as well, because they are also under the influence of the hormone. When they bleed, they irritate the peritoneum. If, for example, if she has the spots can be on the ovary. If she has the spots on the ovary, for example, left side, she'll start with the pain a week before her periods on the left side of the tummy, and she complains about the pain. Okay, and another important thing is if the spots are in the vagina, the back of the vagina, that can cause painful intercourse. So, and if the spots are within the muscles, can you see this as the uterus is a 3 layers, but the central part is the muscle. If the muscle is there, the uterus becomes bulky, and she can have heavy periods, and the heavy periods can be very painful as well. So that is how we call it as endometriosis. So this is a condition which is called a missed disease. If you ask me, why is it missed? How long it takes to diagnosis? I'm asking you a question myself.
I have few things that
okay, sure.
I want to ask. First, is it a better terminology to use the lining? Is it in a layman's words? What is lining? One. And the other question that I want to ask you is, what are the causes for this? But first, let's understand the lining, and then we'll go to the causes.
The lining is actually like, we all have, like, say, for example, how to explain? Intestine. We have a bowels. When we eat something, it should be digested. So there, on the lining of the intestine or the bowel, there will be a lining which causes a lot of secretions. Okay, like that every organ has in our human body. Every organ has outer layer, middle layer, and inside layer. And this is a very special layer. This is the layer because it becomes very thick and is the one which holds the baby. Okay, it is the sac of the baby is inside the cavity. So this is the cavity of the womb. Okay, when it is in the cavity of the womb, this cavity is lined by a double layer. Okay, it has 2 layers. It has a special structure which we don't need, but a part of that structure will be shed every month.
Oh.
Okay,
it's like a pipeline.
Pipeline. No, it's a tissue. Just a tissue comes out, and that comes in the form of bleeding or clots like that, because there'll be a lot of blood vessels. So what happens is when the woman doesn't conceive, because there is the hormone levels drop. When the hormone levels drop, the mechanism is such. So whatever the lining is already formed, they used to say it's a crying womb because the woman didn't conceive. Okay, that's what they used to say in the past. Historically, because the women didn't conceive. So that month, basically the women prepared a bed for the baby. Every month, by the hormonal influence, the woman prepares a bed so that an egg can come and get implanted. Okay? So if the woman doesn't conceive, there is no purpose of the lining of the womb to be, tell you in lay terms, so that will be shred. And then the new cycle starts. If the woman conceives, the lining of the womb becomes very, very thick, and then all the placenta and the baby is fed through that, everything comes. So the sac is inside. So basically, how the nature is, woman actually creates a bed expecting she may conceive. So if she doesn't conceive, that's what comes as menses or menstrual loss. Okay? So that is the physiological thing. You said, what are the causes? They're doing a lot of research. They don't know the causes exactly. The one thing they say is retrograde menstruation. Some of the menstrual loss, instead of coming out, it can spill inside or to the various spots. Okay. Another interesting thing is, they say there's some genetic influences there because it runs in families. If I usually ask you, any of your members' family, oh, my maternal aunt suffered, my mom suffered. So they can run in families. So they're looking at the research in the genetic studies. Another thing is, you'll be surprised, the endometriosis is not just in the uterus. You get it in the eye, you can get it in the brain, and now much more we are seeing in the diaphragm. Diaphragm is nothing but it's a muscle which separates, which when we breathe up and down. So it is the diaphragm which separates our thorax, the upper part, and the abdomen. Okay, and this endometriosis is like an arch. This diaphragm. So then they're seeing endometriosis underneath as well, which can cause constant pain, and the pain usually the diaphragm pain goes to the shoulder as well. So, and that theory is, how is it happening? It may go through the lymphatic system or something like that. And one more theory is, some of the cells, they change. Surprisingly, can men get the endometriosis? They found that if men are given estrogen, even they can get endometriosis. So the reason what they are saying is, some of the cells, the metaplasia means they change. Or in simple words, they can change under the influence of the hormone. It can cause endometriosis.
Sure. You mentioned 3 causes there. One is during the menstrual cycle, that the blood that should come out. Some of it is spilled around the area, which can create inflammation, and that causes spots. The pain. Yeah. Spots, black chocolates is what you call it in medical terms. Yeah. And the other cause that you mentioned could be because of genetics. Yeah. Your parents or whoever had it, it could come to you. Yeah. The third one that you mentioned is the theory around, it could be anywhere. It could be anywhere that it can cause.
Sorry about that. There is another one as the immunity as well. For example, if you have a fever or something, we fight against it. The fever can be severe in some. We all have the fighting system. That is what we call it as an immunity. Okay. And this immunity, they say there is an immunological theory as well. So like basically immunological theory, lymphatic, retrograde, or metaplasia. There's so many theories of that. Not just when the knowledge is scanty, theories are plenty. That applies very well for endometriosis. The way this endometriosis can be variable in each and every woman. It cannot be the same, like the pain and things. So one thing I want to mention is, when a woman has a pain, there is a pattern for this pain. Okay, when a young girl starts her periods, that is called menarche, we call it medical term, or they do all these celebrations because she has started her periods. In the culture is there as well. But the thing about it is, once the girl starts the periods, initially, why all the cycle happens is, if you take four weeks, the first 2 weeks, the women ovaries, these are the ovaries, okay? The woman has ovaries, it produces estrogen. Middle of the cycle, the woman releases an egg. Once the woman releases an egg, then she produces a different hormone called progesterone. So this progesterone is the hormone which creates the bed, okay? Which is the thing, that is. So what happens is, when a young girl starts her periods, the first 6 months, she won't be releasing egg. Okay, there won't be ovulatory cycles. So she may not have much pain and all that. Once she starts the periods, when she starts ovulating, her periods can become painful. There are 2 types of pain in women. One we call it as primary and a secondary. The primary pain is, we see in youngsters, where the menstrual pain or the pelvic pain or pain in the lower abdomen, as soon as the period starts. I'm sure most of the women listening to this, all of them must have had it, when they first started their periods. The day they start their periods, they miss a school. That is called as primary dysmenorrhea, we call it. So that is that happens initially for some. So that settles down after some time, okay? Not each and every woman suffers with endometriosis. A normal woman, she had started her periods and she had this pain the first day of her period. After a few months, she'll settle down, she may not have pain, okay? So I myself remember, I didn't suffer with the pain, so I don't know much about it. At the same time, my sister suffered with severe pain. So the first one is the primary thing. And this coming to the secondary type pain is, if there is any medical problem inside the pelvis, either it should be a pelvic inflammatory disease, or most common is endometriosis, the pain starts a week before. The women, she can actually say, oh, I know my period is coming, I'm in pain. At least like 1 week or 4 or 5 days, the pain starts. And even during periods also, she'll have the pain. And so basically she'll be in pain for 10 days. about almost a week or even before the periods, and then about 5 or 6 days. Almost, if you think like she may be in pain in 2 weeks. Once at the end of the period, the pain settles down because all these spots will become quiet. Okay, and because the hormonal effect will go away. Okay, and then again, when the next cycle starts, she'll start with the pain. So if you see people with suffering with the pain, they feel that they're in pain of almost every time. So when I ask a question, when do you have pain? Dr. Mark, they say, doctor, ask me when I don't have the pain. Okay, they don't have pain only for a short time, like, a week or so in a cycle, in a 4-week cycle. Okay, so that's the pain they have.
You mentioned primary pain and the secondary pain. Primary pain, you sort of said that it's common, normal, which comes and it disappears, settle downs in very soon. The secondary pain is what is actually worrying, because that's what causing a lot of pain, not just during the menstrual cycle period, but also before 1 week before it actually starts. I want to get some numbers. How common is this?
Okay. You know that 1 in 10 women suffer with endometriosis. You'll be surprised to know this 1 in 10 women suffer with this. I still think that is only a tip of an iceberg. Many people might be suffering silently about this condition. In UK, because the statistic I'm working in this country, 1.5 million women suffer with this. And globally, there are 175 million people suffer with this condition. And they say, actually, they say if you put all the women suffering with endometriosis, it can create a continent. That common it is. That is where the sad part is, still it's a missed disease. You'll be surprised to know it is as common as asthma. It is as common as diabetes in women. But still, this condition is not recognized.
You mentioned missed disease a few times so far. Why are we missing this? One.
Yes.
The second thing is how soon one can identify this to start diagnosing.
Okay. No, the reason for the missed disease, first and foremost is women herself they think, oh, this normalizing the pain in the periods. When they have pain, when the women have pain, she herself may think, oh, the pain is normal, because she was told by her grandmother or mother, oh, pain will happen. Once you have a baby, you will be fine, or something like that. So normalizing the pain during periods, even though she has before periods and all that, the pain, that is one cause. Because the women herself, unless the pain becomes so severe, she won't even go and see the doctor. Because everyone say, okay, take ibuprofen, take this, or it is paracetamol, whatever tablet you take, and then, it's normal. Why are you making a fuss about it? So that makes the women actually, oh, am I making fuss about it? It's sad, actually. She should not be in pain, but she feels because of the surrounding people, whoever in the family saying that is one thing. Okay, that is one thing. The women herself not going for help.
I'm so sorry. We'll get to the other part of the question that I've asked, but I just want to dwell that into what you said. This is a monthly thing that is going on.
Yes.
And for a normal person, small cut of the finger, they'll run to the doctors.
Exactly.
To get it stitched if it requires stitching. But this will go on for like months and months, every single month.
Every month.
So if you have to tell again that when one should approach to the doctors by themselves first, because it all starts from you. If you're not in pain, if you're not telling anyone that you're in pain, no one will listen.
No.
And what you just stated is that women themselves think that, this is normal. So what do you advise that if you're in pain, what is the tip of point that go see the doctor straight away?
Okay. I tell the women really, really not to suffer in pain, but especially when they start with the pain. They describe the pain it's a crampy pain, or it can be a shooting pain, any type of pain which is in the lower abdomen. Lower abdomen is below the belly button. Okay, below the belly, when they can, and especially coming before periods and lasting through the periods, they should think about it. This is not right. I should really go and see the doctor. But surprisingly, Chandu, what is happening is women are nowadays, because of the media, one thing they all say the media is bad, but the media is so helpful. They just put in the Facebook or the Google or something, they'll get, it could be endometriosis. Yeah, I have to tell you, over the years, I'm a doctor for many years. Now a woman comes, doctor, I think I have endometriosis. So there is a change has come. So the message, what I'm saying, people may say, oh, we know always. Not many women. There's still women suffering. That's what I want to say, the message. So if you have a pain just before periods, during periods, please take it serious. See a doctor. Okay? Even though whatever the others say and all, they'll be missed school. They can't go to work. The pain can be so bad they can't even go. There is such an impact. Billions of pounds are lost. Eventually, actually, they did analyze what is the loss. Actually, the working hours. What they call is working hours for a women who has women's health related problems, like whether it's heavy periods or painful period. It has an economical impact as well. If you just look at it globally, so many women are suffering and they have to take time off. And they're not able to work normally. That is also thing. Okay. So the first and foremost is the women, as soon as the pattern comes, like another important thing, this I'm talking about the periods. And then when the women, and when she should realize is the women, they also have things like during the menstrual time, because of the areas I said, the spots could be very close to their bowel. That is the bowel, the rectum or the bowel, where the feces normally come out. I'm sure everyone knows about the colon or the bowel. If the spots are on the colon or something, they'll have pain opening their bowels during that time. And they can't, if the spots are on the bladder, they can have pain passing urine. They can during, especially when they have that. Sometimes they can have. Some people have cyclical hematuria. The urine also can be have if the spots are within the bladder, the urine also will be in blood color. Okay, that is called cyclical hematuria, but it is not much noticed because during periods, women always has a bleeding enough. Another important thing is a married woman. Okay, initially she may have, or married, or any young lady, because with the social circumstances, they may be in a relationship and all. So initially she may have a bit of hesitancy to start her sexual life. But what happens is she's happy with the partner and she wants to have an intimate, close relationship with the partner. She will have pain during intercourse. That is very significant as well. So that pain, which is it is also not normal. Okay, when she cannot describe the pain in such a way that she may feel shy to share with doctors or even with the partner. So that is another point, that her partner should understand as well. What is happening? Why is she having pain during which is a sexual life is a normal thing, which is expected. She's not supposed to be in pain. And it should be a pleasurable thing for her and for him as well. But why is she in pain? That is an important.
Sure. Thank you. I want to look at the effects of this, both because this is about women.
Yes.
And as you said, she is part of like everything that happens in the world. There is nothing that can happen. I'm not exaggerating. It's true. As a wife, you're the backbone. If you have kids, she need to look after. And during that period, there is so much that's happening with her already. So let's touch base on the physical aspect of this effect. So as a woman, I've got this condition. What are the other repercussions that I may have? Pain is there, but what are the other effects that you'll have, which is the physical part? And then as we go along, I want to touch base on the emotional and the other aspects that she may suffer. You touch base already on economic side of things, but there is so many other things. We can touch base. Does it sound okay?
Yeah, okay.
Sure.
One important thing, with all these symptoms happen, they did a lot of research. They found that endometriosis, people suffering with endometriosis, they have fatigue. They're tired all the time. The exact reason, they don't know that. But, like pain with pelvic pain with periods, painful periods, pain opening bowels, or pain going for the poo, pain going for a wee, and also pain with intercourse. All these, in addition to all this pain, they are one common feature, because I was also involved in some of the studies. The Endometriosis UK is an excellent thing. We'll come to that. I can tell the way to look for how to look for things and all that. So the endometriosis, they've done a lot. And I was involved in a couple of their surveys and research work, And the main thing, everyone mentioned fatigue. And this research is done that fatigue is also a common feature. Fatigue means that women feels very tired. Okay, for they don't know the exact reason. Either it is because of the pain, but fatigue is also a very important physical symptom with all these symptoms.
Does it have any effect on fertility?
You mean the endometriosis?
Yeah.
Yes, very good. So the next thing is what happens when the woman has it. So with this happens is one important thing is infertility is one of the common things affected by endometriosis. 30% of the causes of infertility is endometriosis. Why it happens is, one is you can look at these spots, whatever you're seeing these spots, they become scars. For example, see, can you see the tubes? This is what happens. Normally what happens is when an egg is released, that is taken by the tube. Okay, this is the normal tube. When the conception happens, when the sperm comes up, the conception happens in the tube. When the conception happens, the zygote actually forms in the tube. Okay, the egg and the sperm, they meet here, to be in a simple terms. Once it happens, the zygote, it rolls down, and it comes and it gets implanted in the womb. When these spots are there, endometriosis are there will be adhesions. Adhesions means scarring. The tube, which should be a very active tube to pick up the egg, may not be able to do its job. See, these are called fimbriae. So they won't be, it cannot pick up the tube because it is scarred, it is stiff. And also the tube structure may change. Normally the tube should move, like a worm, okay. So once the conception happens and the egg is formed, it rolls the egg into the uterus. It's an amazing thing, actually. If you look at the whole how biologically the baby is formed, is a very amazing thing to know. There's a lot of things happen there, a chemical reaction, whatever, prostaglandin, so many things are there. But this is how it happens. So this process is not a simple process; it's a complex process if you think like that. So the egg should be released, and then the tube should be good, and the uterus should be good enough. There should be a bed already for the baby. Then the baby forms. So any damage can happen because of the endometriosis. When there is scarring, the tube may not be normal. There can be adhesion. Can you see this tube? Look at this tube. This is a normal tube, okay? And can you see this tube? This tube is a blocked tube. In this case, conception won't happen. Because you can see we call it as hydrosalpinx or hematosalpinx, like that. So the conception, because the egg is not picked up and it doesn't grow. So all these types of, because of the scarring, the tubes get damaged. So when the tubes get damaged, that's it. For a normal conception, a good sperm should be there, and the egg should be there, the tube should be good, and the uterus should be good. The womb, the uterus, the womb should be good for a normal conception. Things just happen naturally. People think that way. When it doesn't happen, then the fertility problems come. That is the thing which worries the women. So sometimes you'll be surprised, Chandu, this is the endometriosis may not be painful as well. You'll be surprised to know that the pain is variable. Some people have a lot of endometriosis. We do the grading, 1, 2, 3, 4. Severe endometriosis they can have, but they may be without any pain. Or the pain threshold of the women may be thing. So when we actually when I was doing a gynecology, doing laparoscopies and all, I'll tell you what are the things, how they diagnose. When they actually look why this woman is not conceiving, they look inside, she had endometriosis, full of endometriosis, and the tube got blacked.
What is laparoscopy? Can you explain what?
Laparoscopy is a procedure where, they put a camera inside the tummy under anesthesia. They give a small incision under the belly button. It's a camera. Is it how you're doing this cameras like that? But the camera is at the end of a probe. Okay. When you see through the camera, you can see all the internal organs. You can see how the uterus, tubes, and everything. Actually, that is the gold standard of diagnosing endometriosis. Okay. So, for example, when I'll tell you one example. Like when a woman comes in a lot of pain, I've seen women coming with a lot of pain and asking, because it's my specialty, I ask them the questions, and then they say, oh, I'm this, and I suspect, oh, she could be having endometriosis. Okay. And then, if I'm in the primary care, so I'm working in the primary care, I can't do in a primary care, I can't do a laparoscopy. I have to refer her to hospital. So I think that then I will tell the patient. The patient says, doctor, I already had a scan. Okay, the scan was normal. Surprisingly, endometriosis, the scan can be normal. You may not see endometriosis on scan. Okay, the reason is these spots may not be able to see. You can't see them on scan, on ultrasound scan, in a pelvic scan. Ultrasound scan, everyone knows about it because they all have get it done when they want to have when they have their babies. You can only see when this endometriosis is like in the ovaries. Okay, the ovary means is the one which releases the egg. This part, when it has endometriosis, it becomes really big. And on the ultrasound, because I'm an ultrasonographer as well, I do scans for all the, when they come to my clinic, I do scans. So when I put in it's a vaginal scan. Vaginal scan means from below we do it, okay? When we do the scan, we can actually see the ovary cyst will be there. There's a pattern, we don't need that medical thing. But I can suspect we call it endometrioma, or it's called chocolate cyst. Okay, that you can see on scan because it's big and it's filled with all this brownish or old blood or something like that, or it could be like a cyst, to keep it simple. So you can make out, as an ultrasonographer, I can suspect endometrioma or chocolate cyst. That's the only thing we can see. But all these spots and everything, you can't see them on the scan. So if a woman comes to me and says, I have a pain, or I already had a scan, the scan showed nothing. It doesn't, yes, I can say the scan can be normal for you. Okay. But the things which can pick up is the MRI. MRI is magnetic, like, the big, they go through a tunnel and all that. That can pick up. That is another area, very non-invasive. Non-invasive means, see, for example, if you look at the laparoscopy, it's an invasive procedure. Women should be under anesthesia, and she should go to hospital, and then it is the probes or the camera should be put inside the tummy. So that is the step. Many women don't want to do that, but that's how they diagnose endometriosis.
Why?
Because it's an operative procedure. It looks like an operative procedure, isn't it? That is one. And the second thing is, come on, what's the waiting time like? It will take to see a gynecologist in this country. When you refer, it's taking 12 months.
I have a question there. We are talking about the UK. In NHS, the waiting times generally is long. After COVID, it's gone out of the way, which is fine. Let's talk about the condition of the women in
India.
In India,
okay,
or rest of the world for that matter. How would they go about getting it diagnosed?
But as I said, everything is a gold standard. Wise is laparoscopy is the camera looking in through the camera looking is the gold standard. But in India, they can go, but how many people can afford? If you have money and insurance, even in India, there may be people who cannot even afford, that is also there, like they can get the laparoscopy when the women suspects, they can go for a laparoscopy easily if they're same thing in America. If they have private insurance, they can get it done. But if we look at it, we actually jump from the missed disease to this point.
Yes.
Okay. So let me take you a step back. This condition is missed on the time interval from the presenting symptoms to the diagnosis. It takes years. You'll be surprised to know in England it takes 9 years. In America it takes 11 years. In Germany it takes 10 years. In Wales it takes 10 years. Like that we have statistics. It's not just, that is why this condition, because right from the women present the symptoms to diagnosis. What is the diagnosis? Laparoscopy is the diagnosis.
How expensive is this for someone who wants to do it themselves?
I cannot say like it'll be thousands if they have to go private in this country, but I don't know about how it costs in the India wise. But not every woman need a laparoscopy as well. We'll come to that point. Okay?
Yeah, yes, please. Because what obviously we both want to give away to women is, if you have the condition, how best possible ways are available to get it diagnosed. As you said, that is very expensive. So is there other avenues that they can go and find? Please.
Okay. The one thing is, with the endometriosis wise, like one is the suspicion is very important. The doctor should be a very good listener. When they go to see a doctor, they should listen to it. A good listener should be. Another important thing, why is it a missed disease? I'll tell you something. The uterus sits in the middle In front is the bladder. Bladder, where the urine collects and which comes out. That is the bladder. We can show that picture as well. And behind is the bowel. The pelvis has uterus in the center, front is the bladder. So the condition mimics other conditions. So if you see a young woman, I've seen quite women, they say, I have irritable bowel syndrome. They blame, because they have bowel symptoms, they think it's a bowel problem. So many of the patients, they actually see call a gastroenterologist. See, the reason for the delay, I'm telling you. So first of all, the pain they don't present. But second thing is, the person who is listening should have a knowledge. We did a study in JLA study, James Lind Alliance. There are 3 top questions came. 10,000 people were sent the questionnaires. First thing is they asked what causes endometriosis. And second thing, why some people should suffer all that. The most important thing is, what about the knowledge of the doctors? Why my doctor? The all parliamentary group, you call APPG, in this country, in 2020, they did a study. They had 58% of them went to see their GP 10 times with this pain. And they are the frequent attenders of A&E. So when they get the pain, they go to A&E. They had no choice. So the main thing here is the knowledge of the condition as well. My job as a gynecologist, luckily I have the opportunity to do guest lectures for the GPs, for the practice nurses and all. So the most important thing is the patient. Second is the medical person. Here in this country, they go to a practice nurse. So if the practice nurse has a knowledge of that, endometriosis, the another thing is the funding in general for women's health is all over the country, all over the world is very low. This is what the debate is going on. Okay, for asthma, there's so much funding. For diabetes, there's so much. When this condition is as good as asthma and diabetes, there's not enough. So the education, the most important thing is education of the medical people, the nurses and doctors.
Where are we on that? Globally, and then we'll come to the UK.
Globally, I'm with the Endometriosis Society for the last 15 years, okay? They're more and more aware of it. For example, the people in the Royal College of General Practitioners, okay? Royal College of Obstetricians are the main people of the obstetrics in this country. Gynecologists were there. They have published papers and all that. But it is at the higher level. But it should go to the primary care level. Now, they have done the course and everything. They have put it as a part of curriculum for this training doctors that endometriosis is also part of the curriculum. Okay, so if you say from the percentage of this, I can't give you exact figures, but it has improved. So I'm seeing the doctors, GPs, nurses talking about endometriosis. Even the word was not used before. You'll be surprised to know that.
That is in UK.
It's in UK.
Do you have any
same thing
everywhere?
I think because the diagnosis is happening so many years, taking so many years, I'm sure it must be happening same thing in other countries as well. Why should it take to diagnose a condition 9 years, 10 years, 11 years? If the medical person has, if for example, if someone comes with wheeze, when immediately I'll think, oh, he must be having asthma. Or you say that, oh, doctor, I'm drinking too much, eating too much, weeing too much. Oh, he could be having diabetes. So it's the same thing, that is the knowledge, which is important. So I have a feeling, not me, I'm not saying I'm the person this, but in general, Endometriosis Society and the doctors who are dealing with endometriosis, the doctors, nurses, everyone who are so much passionate about this condition so that the women should not suffer, they think it is the knowledge. So that is what they're trying to improve as well.
That is from the medical side of things. And we touched upon the patient or the woman side of things. But I just want to reiterate that so that, it's clear for women what they need to do. Yep. If they think that they got this condition, go check with your doctor. Is that what you're suggesting?
Yeah. First of all, what they have to do is, yes, they have to check the doctor. They can actually go on to a proper websites as well. For example, what we have in the UK is endometriosis.org.uk. But just they put endometriosis.org.uk, it will come. Do you have, what is endometriosis? Do you think you have, there is a like a questionnaire,
Frequently asked questions.
the frequently asked questions, and also they can they can fill in like a thing. Oh, it could be this. Yes, yes, yes. Then that will tell them, oh, you could be having endometriosis. Go and see your doctor. Okay. But that is one thing, in the pain, when they have a pain, they should definitely go and see their doctor or even the nurse if they can't get an appointment. And first of all, most important thing, Chandu, whether they go the laparoscopy diagnose, woman is not bothered at that. She wants pain relief. She wants pain relief. That is the key point as well. So whoever listens to her, they have to have, first of all, they have to treat their pain.
One thing I get from all the causes that you mentioned is there is no human-made cause that can cause this. It could be genetic, as you said, and the spill of blood to the other areas could also be naturally. No one need to do anything. No. So what I was trying to get to is women going through the pain might not necessarily because she has done something. As the top gynecologist sitting here said that it can be natural. Without even her doing anything, she can get into pain. But now she got the pain. What she need to do?